Mental Health Awareness Month is coming to a close, and it's been a trying time for so many of us. We're still, of course, living in a pandemic, which has already taken more than 1 million lives here in the States. Plus, this string of recent mass shootings is taking a heavy toll on a lot of people. According to a new report by the Chicago School of Professional Psychology, people in underserved communities are suffering the most. Joining me now to talk more about this is Dr. Michele Nealon, president of the Chicago School of Professional Psychology right here in LA. Dr. Nealon, thank you for being here. An important topic to talk about. We have a lot to get to. I want to start with this report. I understand that it found that 84% of those surveyed had increased anxiety during the pandemic, specifically those in underserved communities. Why is that?
Well, actually, and good morning to you, Bianca. This really is about something that's long been in the making in the United States. There are very serious health disparities related to race, gender, and socioeconomic status. The pandemic exacerbated the issues related to social problems for too many people and also for the mental health problems that were there. And there simply is a disproportionate impact, as well as the lack of ability of African Americans, the Hispanic Latinx community, and the LGBT community plus in particular, to reach out and be able to get the services that they need.
So you mentioned this disparity, right, in healthcare. What can the American mental health care system do better, change, to make sure that everybody benefits, not just those with social or economic privilege?
Yes, so the first thing is we have to recognize that we are living through a mental health pandemic. 1 in 5 adults in the United States has a mental health issue. 1 in 6 of our children. Suicide is now the second leading cause of death, second only to gun violence for our children ages 10 to, and young people up until 34. So the first one is, Bianca, we've got to sit up and take this seriously. We have to get all of the policymakers and the influencers to stop the rhetoric and the polarization and start paying attention to funding the workforce pipeline in mental health, getting enough, particularly multiculturally competent, trained professionals into the schools, into the community behavioral mental health services, and take it seriously.
I know there's a lot of work to be done there. I want to shift now to this latest string of mass shootings we've been experiencing. I know this report focuses on COVID, but when it comes to mental health and the impact these shootings have on it, I'm just curious your thoughts. I know, my gosh, me personally, friends of mine, people in this building, everyone's just saying this one just hits differently, and it's really hard to process. Talk about the effects on mental health that these kinds of shootings have for people who are watching the news and just inundated.
Well, first of all, what an unconscionable act that happened in Uvalde. Certainly for those that are in the community, the level of trauma, no doubt, is exceptionally high. But also for those looking on, there is something known as secondary or vicarious traumatization. Those that have not been directly there, certainly witnessing, reading, hearing about it, can be traumatized. Bianca, coming out of the pandemic, 62% of Americans that were surveyed by the American Psychological Association said that they were experiencing symptoms of trauma. That is, whether they had experienced COVID themselves, experienced the loss of a loved one in their family. So there's already such a raw feeling in the United States, and watching incidents like these compound the experiences and really the negative symptoms that people are experiencing individually and collectively.
Right, yeah, it's been so heavy this past week just for us all watching it and reading about it. You have to imagine, and we're so far removed, right? So you have to imagine the people the children that witness that experience, that the long road to recovery they have. That's another conversation, of course. Dr. Nealon, thank you so much for being here and shedding light. We appreciate it.
Thank you.